This indeed is a celebration, and it's a truly momentous day for the state of Louisiana. Today we launch the Louisiana Behavioral Health Partnership. It's a new way to do behavioral health in our state. And really, it's a highlight of what the system will be and starkly contrasted with what the system has been in the past. First of all, as the name implies, this is a partnership, a true partnership. Here in the room you'll see leaders of 4 different state agencies, all of which provide services for kids. Dedicated providers, professionals, families, parent advocates, all working together with our statewide management organization, Magellan. Not just to find or implement a better way for financing health care, but a better way in serving people with behavioral health needs. But more importantly, it's out there in every corner of the state. The clinics, the hospitals, private practices, residential treatment facilities, and in-home services were, for far too long, difficult to negotiate, different to navigate, too difficult for families to get everything that they needed when they needed and where they needed. It's been a system held together by sheer dedication of our state's medical professionals, our treatment specialists, psychiatrists, psychologists, social workers, counselors, families, and patients. A system somehow patched together through multiple bureaucracies, ours one, and funding streams that haven't always made the most sense or gone far enough. It's a system that's delivered unacceptable outcomes, where people have been stuck in a cycle of crisis treatment with no way out. Now, we've worked hard to make marginal but important improvements. In recent years, we've invested in community-based services that are helping to get people out of institutions and into appropriate levels of care. We have recognized the interconnectivity of mental illness and addictive disorders that have changed the way we do business to begin to treat the whole person. But today we rewrite the book on behavioral health in Louisiana, a transformation that completely dwarfs our previous efforts. Today, I'm particularly proud to stand here with Magellan's chairman and CEO, Dr. Rene Lerer. Magellan brings tremendous experience in coordinating behavioral health services to Louisiana, and already has shown its commitment to our state by opening offices here in Baton Rouge, in Shreveport, and hiring more than 200 people here, working in our state, living in our state, working to make this vision a reality. Today is the kickoff for the Louisiana Behavioral Health Partnership. It's the first time we'll ever be able to put together in a coordinated, managed fashion all of our behavioral health providers and services in one place with one phone number and one set of services.
What will this mean for people across Louisiana?
First of all, greater access and much more simplicity. Again, one phone call to access all services. And this includes even services from the Department of Children and Families, Office of Juvenile Justice, and Department of Education, as well as DHH's, the services that we offer in behavioral health. But also it involves having a keen awareness of all the services that an individual is getting through an electronic health record, so that providers throughout the continuum will have full understanding of what that patient has and needs.
I think this is an introduction of a new system of care that will give people access to care, to get the best care that's available to them, and to improve it to the level of capabilities that they're able to do. So it's a system of recovery, get people in recovery and in resilience, to keep them in the community and community-based services so they can truly excel.
What's going to be different for people?
I think the key component that's going to be so different is the fact that before March 1st, there was not a single point of entry into the system. So individuals had to figure out exactly how they were going to navigate the system on their own, and they're going to have to do it at a time when they're in the greatest amount of need. After March 1st, you have a single point of entry through the Magellan system, and we help navigate you to the right care in the right setting at the right time so that we can make sure that there's a continuation of care and we can move you through that continuum and benefit anyone that has to access our system.
I'm truly excited about the collaboration between the 4 child-serving agencies to work to make sure that children remain at home when at all possible. We know from our research and from statistics, children do better when they remain at home. So the more that you can wrap community-based services around those children and families, the more likely they'll be successful.
I think it's going to mean a better system in terms of providing care to those who need it the most. One of the things in New Orleans we've not been able to do is to really look across systems to see how people utilize those systems and to be sure that they're in the right level of care and be sure that they're receiving the right quality care. Magellan will be able to measure that, be able to look at that, and then in partnership with an agency like mine, be able to give us direction in terms of where we need to go quickly to be able to provide the best quality of care, but also Magellan will be able to get those clients we serve in the primary care. Because of course, we just can't provide behavioral health care and not take into consideration the fact that the people we serve also need primary care, because primary care is going to keep them living, not necessarily behavioral health care. So to be able to do both is the kind of system that we truly want, and Magellan should be able to deliver for us. And I think it'll be great in New Orleans.
As a parent and a parent advocate, it's going to mean tremendous outcomes for our children. We've waited for this service for a really long time, and we're very excited. As a family support organization, we're excited to be there with the families and support them through the entire process.
I think the partnership is fabulous. I think the commitment by the folks in the state, with all aspects of the state, is truly a demonstration of what's important, and our commitment to partner with them to move forward is really a great thing. It's really unique in what we've seen across the country.
This is a truly momentous day. We've had a very fragmented, uncoordinated system for people that has failed in multiple places and multiple times. Today we bring all of those pieces together. We provide care when people need it, where they need it, and for the services they truly need. This is a large step forward. It will keep people out of institutions and hospitals and will give them the care and services that they need.
It is really unbelievable. What's been most encouraging to me is to watch this partnership come together, and I mean truly a partnership. Last evening at 12 midnight, we turned our phones on. When we turned them on, not only was the Secretary of DHH there, the chairman of our board was there. We had all of our leadership team on site at midnight. Now, if that doesn't spell a partnership, I don't know really what does.
If people have questions or like more information, what should they do?
The easiest way to go about getting information is to go to MagellanofLouisiana.com. Now, there's a huge amount, a wealth of information, including webinars for providers, training sessions. You can get any and all information you want about this partnership through that website. And then if that doesn't work for you, call our lines. We're up 24/7, 365 days a year. And so you can always reach a warm body who's going to pick up the phone and is going to say hello and find out what's going on and direct you.